Hey everybody. So it's been a little bit since I've posted. That hasn't really been by accident, I guess. I had some things come up and I kind of wanted to recap some things with my weight loss journey all together, all in one video. So that's kind of what this is for, is kind of killing two birds, one stone. So let's get started. I did a couple of shorts, and the last video was talking about when I was at Cleveland Clinic to get some lab results drawn or get some lab tests done. I did an EKG. I also did a chest X-ray. All pretty standard testing. The results are in. Dun, dun, dun. As far as chest X-ray goes, everything looks normal. She did say that there was some sort of a congenital situation with my rib cage or whatever, and normal for me, I guess, maybe is a better word, that I have some fusing of my vertebrae in my upper back area, which is simply because of poor posture and my chestiness, if you will, that I've been carrying around for the last, 30 years or whatever. I guess it wouldn't be that long. That'd be creepy. But the last 25 years. So those are standard. Those are normal for me. So there's no problems there. The EKG, it was kind of cool to see the 12 lead all spelled out with all of the measurements and all of the coolness that I don't normally see in the back of an ambulance. So I was able to look at all that stuff. The doctor that interpreted is something slightly abnormal, but nothing crazy. And honestly, I didn't see hardly anything weird. So there's that. I haven't got anything negative on that. The lab results were normal for me, what I would expect. My glucose was a little high, like 130, 40, 50, somewhere in there, which is typical. It's standard for me. Also, it was not fasting, so yay for that. My A1C had come down 0.2. It was a 6.6, I think, and it had come down to a 5.8 or something similar to that. So that's good. Improvement is good. One of the abnormal lab results was elevated ferritin. So ferritin deals with your iron stores in your liver, and I have extra. So along with that, it was kind of strange to see. I've never had a ferritin test that's been high. However, my total iron binding capacity in the past has been low. So I have been taking iron for a few years now. I think 2 years now, give or take, maybe 3. I went through a period where I could not work even a 4-hour workday. And I have a desk job, mind you, but I couldn't work a 4-hour workday without taking a nap. It was so sad and terrible. I was working half days and I was struggling to get home without falling asleep. And I would sleep all night. Like, I slept all the time. And a day off, I maybe had 6 waking hours during the day. The rest of the time I was asleep. So it spawned a bunch of lab tests and this and that and the other thing. And my total iron binding capacity had been low that whole entire time. Not my iron, just my total iron binding capacity. So Google that. Also, TIBC would be the abbreviation for it. So it's been low a lot. So when we did this round at the Cleveland Clinics, my ferritin was high, but my total iron binding capacity was normal for the first time in I don't know how long, a really long time. So I was glad to see that, and also a little concerned that the ferritin's high. But I haven't gotten any feedback as far as what does that mean for me, blah, 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 blah. So we're just kind of chilling and waiting for that. In the interim, I did have a meet and greet, and this just happened a couple of days ago. So today is Saturday, November the 4th, I think. November the 4th. This happened on the 2nd, November 2nd. I had a meet and greet virtually with my Cleveland Clinic bariatric doctor that's going to walk me through the whole process. So this doctor, Dr. Ricardo? Anyway, super great guy. He is going to be with me the entire time. walking me through this process. One of the things that we talked about, and this is something if you're considering a bariatric surgery in any way, shape, or form, you definitely need to be comfortable with being honest with yourself and being honest with who you are, the medical conditions you have that are associated with the weight that you carry, the medications you're on that are associated with being a bariatric patient, because those were all things that we discussed. And he very bluntly and honestly told me that for being 36 years old, he looks at my chart and thinks I'm like 80, which is not untrue. It was a little hard to hear, to be quite honest. It was a little hard to hear because he's not wrong. And I often joke about that. I think because I don't want to really acknowledge that fact, that is where I'm at with life. So, anyway, he is very fantastic, a wonderful guy. We did a little meet and greet. We were discussing the surgical procedures, the two big ones that they offer, the Roux-en-Y, and the gastric sleeve. Now, of course, obviously based on my YouTube channel, and my thought process was always the gastric sleeve. One of the comorbidities or one of the other associated weight conditions that I have is GERD, which is basically acid reflux. It's a gastrointestinal esophageal reflux disease. Woo! GERD, thank God that's short, right? So one of those things, you might find that if you're in that same boat, you would take Prilosec probably pretty often, or you're constantly popping Tums, one of those things, to kind of help that burning sensation that's in the pit of your tummy and maybe even up into your chest and your throat go away. I had GERD for several years, probably 10 years, give or take some. And I've also had high blood pressure since I was 18 years old. And like I said, I'm 36 now. So this is a really long time to have high blood pressure. And I've been on medications for a very long time, since I was 18. So that's associated weight issue. Insulin resistance, I also have that. I've tried many medications to try and facilitate better control of that, and nothing has really worked for me. My insurance company will not pay for the injectables like Wegovy or Ozempic. They will not allow that because my A1C is not 6.2. It was 6 or whatever. Like, it's so dumb. Because it really could help me and it could save them money on a weight loss procedure or future billings of weight related conditions, but whatever. I'm not an insurance company. Bleh. So, we are chugging along. I meet again, this month. Actually, I think it's next week. I meet with a psychiatric doctor. Also one of the steps that we're going to be doing is the nutritionist. They recommend several appointments. However, I'm already on the path to that. I have Dr. Anthony. I've met with him several times already, being on the non-surgical weight loss pathway through the Cleveland Clinic. So there may be a couple of hoops I don't have to jump through prior to surgery. Prior to surgery approval, I guess, well, not approval, I've already been approved, but prior to the surgical procedure, it kind of hems up some people. It takes a little bit. Of course, you have to go through the hoops. You have to understand that you need to eat better. And he is great. He has some really great tips. One of my favorites I'll share with you. It was one of the things that I try really hard. I have to force myself to do it, force myself to think about it, but it's one of those things that really, really works for me. He told me really early on that one of the things that he tries to instill in people is eating slower. And I'm like, ugh, like I am like that puppy that has to fight over food. I am like, give me my food and it's gone in 5 seconds. I think that's just the way that we as humans are, that it tastes so good. Maybe even it's an American thing. I don't know, but it tastes so good. We just have to eat it all right now. And we don't chew our food. We don't really flavorly savor our food. Like, we just inhale it. One of the things that he talked about was eating slower, forcing yourself to chew it more. So me, I'm OCD and I'm a numbers person. Like, I like counting, that type of stuff. Like, it really just facilitates the good juju for me. So I decided I would count as I chewed. So every bite I took, I counted to 10 and then I would swallow. Like I would chew, counting to 10, sometimes 12, whatever, 15, whatever I felt like. It would depend on the food too. And then I would swallow it. And I kept doing this and doing this and doing this. Every bite I took, every meal, I got fuller faster. I wasn't eating nearly as much food. Something so simple, like I guess tricked my brain into like, my brain is like, maybe I'm full. It actually had the time to stop and think about being full before it had a meltdown of, I have no more food left. And now I'm so full that I can't take it. So think about it, it may not work for everybody, but that was what was recommended for me. It was really great. So it really worked out for me, and I still try and do it as often as I remember to. So yeah, one of the hurdles that I was faced with last week. So one of the things that really is going to be interesting as we go forward. And again, this is just a me situation, particularly. It's not obviously all people. But one of the things that I have to, I guess, grapple with, and a hurdle that I have to overcome now, because when it rains, it pours. And if I didn't have bad luck, I would have no luck at all. That's just the way my life is. So, I had we'll call it an abscess in my right ear canal. And it had been there for a very long time, like 2 years. And it got to the point about 6 weeks ago where it grew. I was like, that's weird. And then my ear started hurting. So I thought, great, I have an ear infection. So I took some antibiotics that we had here at the house. It's bad practice. Don't do it. And I went in to see my family doctor. My family doctor is actually the CNP, says, that looks like a varicose vein in your ear. And I'm like, that's weird. But she said, we're going to have an ENT look at it. And it's not uncommon for me to have varicose veins. I have them everywhere. In fact, later this year, I have a varicose vein stripping procedure to do at OSU. So yay on that. So I was like, that's weird. So I waited for 4 weeks to get into the ENT. I saw the local ENT here, and she was fantastic, by the way. Dr. Klaptar, shout out. Marytan ENT, fantastic folks over there. She looked at it. She's like, oh, okay, we can just go ahead and cut it out. So I got an appointment, I think the next day even. I couldn't do it the same day because insurance wouldn't allow it because I was a new patient. So got that thing chopped out. It was a really fairly easy procedure. It took about 20 minutes. It was weird because like this whole part of my face was numb. So it was kind of funny. But she sent it off for pathological evaluation, and that was on like a Wednesday. Oh, sorry. Still too early for me. She called me on that following Monday. Was a Monday. On the following Monday, and said, hey, your pathological results came back. The doctor wants to talk to you about it. It was like her nursing assistant or something. Doctor wants to talk to you about it. I said, okay. She said, can we move your appointment up? Because it was a week from that Monday. Can we move your appointment up to like tomorrow or the next day? And I'm like, oh, geez. Well, I had a work-related thing, and I wasn't sure what was going to happen in those 2 days. So it really was not an option for me. And I told her, I said, listen, I really can't. I have this thing. And she's like, well, let me see if she wants to go over it with you on the phone. I said, okay, call me back. So she did. And that day was just a normal work day for me. I had nothing crazy going on. And so she called me back and she said, listen, she would really like you to come in. How can we make this work? And I said, listen, I can be there in about 25 minutes because that's how far away I was, because that's where I work. And I said, I don't have anything really going on today that's super important that I can't put off until, later on in the week or whatever. I said, I can be there in about 25 minutes. And she said, okay, come on down. We'll work you in. Great. So, of course, I'm freaking out. I tell my bosses that, hey, listen, there's this thing. They knew about the thing in my ear, and they knew that I had it chopped off. So they were like, okay. And the one girl, she goes, don't freak out. And I'm like, that's too late for that. So I called my husband and I said, here's the story. And he said, I'm coming with you. Come and pick me up. Lucky for him, he works 0.6 miles away from our house, and it happens to be kind of on the way to the ENT. So I was able to scoot home, pick him up, and take him with me. And I was nervous. Dr. Clapchar was amazing and fantastic. She explained everything she could to me, as well as set me up with a referral doctor. And the diagnosis, and I'm going to read it off the paper so I don't mess it up. The diagnosis is moderate to poorly differentiated invasive squamous cell carcinoma. So the long and short is that the thing in my ear was cancer. And it had a stalk that they severed, obviously. So I have skin cancer in my ear canal. I don't know how, I don't know where to go from here. I don't know where we're supposed to go from here. But I always told myself that if I ever had cancer, that I was going to go to the James. Lucky enough, Dr. Clapchar had a resident or someone during her residency that was a mentor to her that works at the James. So, Dr. Kang, I'm coming for you. We have an appointment set up with Dr. Kang from Ohio State University, the James Cancer Center, November the 16th, to look at this and see where we go from here. I'm not really sure exactly what's going to happen, but, I have a really dark sense of humor. I think it's, in part from being public service, as well as being an EMT for so long and a paramedic. So finally it's starting to hit home with me to be able to say, I have cancer. I never thought at 36 years old that I would be saying that to anyone or even thinking about it. And I've made plenty of bad choices in my life, trust me. But skin cancer? Like, I don't go run around and tan. I try really hard to do the sunscreen thing. Sometimes I really suck at it, but it's in my ear. Like, I just do not get it. I don't understand how it works like that, but whatever. I am not a doctor. I'm not a cancer specialist. So, we're going to go to the James on the 16th to meet with Dr. Kang, and we'll see where it goes. And I did talk to my doctor from the Cleveland Clinic about this for the weight loss program, for the bariatric program. And he said, and I think this is what made it really real to me. He was talking to me about it, and I told him that I was just diagnosed, this week. And he said to me, I'm so sorry. And I'm like, well, never had anybody say that to me. So it really hit home for me that this is really what's happening. Like, really, I have ear cancer. It's just so weird. But anyway, so the doctor from Cleveland Clinic from the bariatric program said that we will work in parallel. So I'm going to still continue my path with the Cleveland Clinic and also with the James. Obviously, we don't know enough yet about the James, how deep the cancer is, in the process for getting rid of it or what exactly that looks like yet. Dr. Kang has not even seen me yet, so we'll figure that out as we go. But that's the plan for now. So all the good juju, all the good vibes, prayers, whatever it is that you do, I would greatly, greatly, greatly appreciate them as I continue this weight loss journey and a new journey at OSU, the James, for my squamous cell carcinoma. So, my shameless plug today, this is breakfast. I have a work-related thing coming up. I need to leave in like 3 minutes, so that's where we're at with life this morning. But, Atkins shakes. This is a coffee protein shake, mocha latte, yum yum in my tum-tum. It's very good. Super, it's a fast thing on the go. I can drink it while I drive, and it's really good. So this is going to be my morning coffee today, and we'll see how that goes. So thanks for watching. Let me know if you have questions, comments, concerns in the comments of this video. And thanks for watching. And if you like it, want to learn more about either my squamous cell carcinoma, my life, or my weight loss journey, like and subscribe. We'll see you guys later.